Morning, everybody. In the office this morning, so normally at home, but come into the office today. Hope you're all well and haven't been snowed in or anything pre-opening. So nothing worse than snow in April. What we're going to cover today, we'll be covering update for COVID, ongoing control measures, some new tips and thoughts on that, test and trace, compliance, looking after staff, right directions updates, and your questions. And I'm conscious of time, so I'm not going to talk for much longer. I'm going to hand over straight away to Ian.
Hi everybody. Hopefully in terms of COVID, this will be one of the last you'll have to put up with me droning on. But as Jill said, there will be one more when hopefully after the 10th, the last announcements will be made about the 21st, the 17th reopening dates. So what's been happening? I'm sure you've all kept abreast of it, but clearly UK government has confirmed that parts of the indoor economy and further outdoor settings will reopen as of the 12th. And similar announcements have been made by the various devolved authorities on devolved powers in relation to their reopening timetables. The 4 tests that they set, the vaccine deployment, evidence showing the vaccines are effective, the infection rates and the surge in hospitalizations and the assessment of risk from variants have clearly all been met, and we're all hopefully enjoying seeing the very positive news coming out of the daily updates on where we're at with all of those elements, which clearly is encouraging for the future. Similar tests have been applied in other nations, and they similarly are doing the same sort of roadmaps towards reopening, which we'll detail in a minute. Okay, next slide, please. In England, gyms and indoor leisure centres and swimming pools can reopen for individual use, individual exercise, indoor group exercises, and group sport can resume no earlier than the 17th of May, clearly all reliant on us meeting the roadmap goals. Trampoline parks, children's play, skating rinks will be able to reopen on the 17th of May, all being well. Scotland, gyms, indoor leisure centres and swimming pools can reopen on the 26th of April for individual use. Indoor group exercise is planned to resume on the 17th of May, and they're still to make formal announcements regarding family activity, soft play, trampoline, etc. And they're unlikely to reopen until early June. In Wales, similar issues. Gyms, indoor leisure centres and swimming pools can reopen on the 10th of May for individual use. Indoor group exercise and sports again targeted for the 17th of May, but with a restriction on the numbers to 15 only in those classes when they do reopen. In Northern Ireland, from the 12th of April, up to 15 people can take part in structured outdoor sports through clubs or individuals affiliated to recognised sports governing bodies. And a further review will be taking place on the 15th of April as to what their next steps are. In the Republic of Ireland, from the 26th of April, outdoor sports can reopen for a maximum of 2 households. There is yet no update on when indoor sports activities can resume in the Republic of Ireland. Hopefully, though, they too will be able to get the vaccine programme going and will catch up fairly soon. COVID-19 headlines. Everyone's delighted with the rollout of the vaccine program. We're clearly enabling a lot more activities to look positively forward, and there's all good information coming out there. Surprising to me that they're predicting the R rate still is where it is at 0.8 and 1 when the case rates are still dropping dramatically. Let's hope that trend will follow and the R rate number will come down significantly in the future. People testing positive has dropped by 36%. However, that is only as good as people coming forward if they think they've got symptoms. So we'll come on to that in a minute. We need to encourage staff to make sure they're taking part so that this lockdown is the last one and that we reopen permanently. As we know, hospital admissions continue to fall and the death rate itself continues to fall, which is all very positive news and hopefully means that we are seeing the ability to return to some normality coming forward. Next slide, please. The messaging has changed slightly, but still remains in place. So There's clearly strong and unchanged guidance at the moment in terms of social distancing, use of face coverings, frequent cleaning of hands, adequate ventilation, and the good hand cleaning. The message itself in terms of the way it's presented now is recognizing this issue about ventilation by the fresh air requirement at the bottom of the NHS logos. So that really is something. We as an industry were the last out of the first lockdown. This time, I think because we've demonstrated that we did have quite strict controls over fresh air, that this time we're actually the first out. Whereas hospitality, which was the first out last time, is looking like being one of the last out. So it is all about this fresh air and changeovers of air inside. So it's an area that we need to focus on and continue to focus on, not only for COVID, but for all infections and airborne transmitted diseases, which could be an issue for all of us going forward as people begin to mix again. Next slide, please. Social distancing remains 2.2 meters and 1 meter plus with mitigation where you can't maintain the two distances. Sorry, can you go back a slide? We jumped. So, okay. So make sure, obviously after the first lockdown when we reopened, everybody had wonderful signage and floor markings. As people come back with more confidence, it's important that we keep these issues in place. So make sure you go back and review what you've got in place and that it's clear for people. It might need refreshing, might need some other way of thinking of doing it. Are there queuing systems in place? If you think that for certain classes you're going to be busy, make sure you've thought those through again and that staff are aware of them. Are facilities such as showers, toilets and sinks and equipment spaced and cordoned off to help maintain social distancing and prevent unauthorized use? We saw from the first lockdown when we went into facilities, lots of activity areas have been repurposed. We saw cafes being used as spin studios. Now we know that there have been a number of cases, mainly at home, where people have repositioned equipment or got equipment at home where children or young people have been able to access that equipment and then have suffered, unfortunately, fatal injuries. So if you put stuff into a cafe, how are you controlling access to it so that a child or younger person doesn't go and access the equipment and then have an accident while not being supervised? So just an area to think about. Going back to ordinary health and safety, has your risk assessments considered that, and have you got suitable controls in place? And have you still got your booking systems to ensure customers arrive at separate times and do not congregate in key areas? Face coverings. Face coverings must still be worn in public indoor settings. Clearly there are some exemption for individuals with certain conditions, and clearly you'll need to try and help staff understand how they question and try and encourage use of it where people don't have exemptions. It's a customer care issue which you need to think through and make sure staff are aware of. In gyms, leisure facilities, they should be worn in all areas, but may be removed while exercising or partaking in physical activity, and that includes staff. So people moving around the centre must wear must wear face coverings. There are certain nuances in that if a receptionist is behind a screen on her own or his or her own, they won't need to wear a face covering. But if there's another receptionist alongside them, then they will need to be wearing face coverings if they're not more than 2 meters apart. The next point won't apply until the 17th of May, but when we do come back with being able to have indoor hospitality, people would be able to remove a face covering to be able to eat or drink indoors. And staff working in the facilities should also wear them in all areas where they're walking around. In offices where they're more than 2 meters apart and they're less exercising, then they can. So take the face coverings off. Okay. Cleanliness.
Tell you more.
Cleanliness is important as ever. although airborne transmission is now known to be the primary. So can I just ask that people check their sound? We've got somebody coming through. Although airborne transmissions is now the primary cause of way that COVID is transmitted. You still got your cleaning schedules up to date and making sure that they're as appropriate and they include the frequent touch points. Are you still encouraging customers to clean equipment? Just make sure you go back before we reopen, that you review all those issues and make sure that they're as strongly in place as they were after the first lockdown, and after clearly we proved that as an industry we were taking this seriously and able to reopen the first time out this time round. It's going to be important for customer confidence, so make sure it's still fully in place and staff are encouraging its use. Okay, next slide. Ventilation. As I said earlier, the fresh air part of the logo is a recognition that what was imposed on us applies to everyone now, and that airborne transfer of the aerosol is the most significant route of transmission. Clearly, we're still limited by the capacity of providing one person per 100 square foot of space that we can accommodate within our building as a whole. You must ensure the ventilation systems provide 100% fresh air where they can. Dampers are fully open and run fans on full speed for 24 hours. Don't shut them down at night unless they've got variable speed drives that ramp them back. The air handling should continue through the 24-hour period. Opening windows and doors should only be propped open where it's not going to compromise fire safety, or you should fit issues, which hopefully you did first time round, that allow the doors to close on the fire alarms activating. And there's quite a lot of good guidance, in the HSE guidance that's just been reissued, which we've highlighted there at the bottom. And that refers you also to the CIBSB guidance, the Chartered Institute of Building Engineers, which talks about windows at high level are more effective, and that you don't need to open low-level windows that high so long as air is transferring from one area to another. And as I think we've said in the past, where air exchanges are unknown, the use of appropriate CO2 monitors is one way that you can detect CO2 buildup, and hence buildup of expired air from people that could be contaminated. So it's a measure that you can use effectively. We know other people have used and seen it used well. Hand hygiene. Clearly, quite prominent in the first lockdown and the first areas. I think this is important for you as businesses, that you still continue to encourage staff and customers to use it, and it needs to be encouraged. Look at yourselves and think how much of the massive stocks you all ordered you actually went through. It perhaps tells you how much they're being used, but not only for COVID, but for your businesses and people going off sick. If people now are beginning to engage and congregate together, the incidence of ordinary infections like colds and flu is going to start going up again. People haven't been subjected to this for over a year and are going to be more likely to catch colds and flu. So we think it's really important that as staff come back, you re-emphasize this thing about regular hand washing and use of sanitization, as much to protect your business. Staff, if they go down with colds, are going to suspect it's COVID, are going to not come into work, and are going to affect your businesses. So I think the encouragement of hand cleanliness is important, not only for COVID, but for your general business, and trying to reduce the number of days that staff go off sick with other virus infections. Okay, next slide, please. Test and trace. Contact details. You should either have received or will be receiving an update saying please download new posters that are meant to be easier to read, and which you are now required to encourage all people using you to use. It should not just be the lead person who is booking something. So if it's a family bubble coming in, it's not just the person booking, it's the other people in that family group that are coming in to take part in the activity, who all need to use either the QR code or you need to collect the evidence for. and that's for people over 16. Slight differences in one or two of the different devolved powers, but if you keep track of that, there are obviously a lot of emphasis now being put on using the test and trace process to try and control this in the long term and monitor progress with it. Okay, next slide please. Been a lot in the press regarding free rapid lateral flow tests. Initially it was for employers in England to test employees twice a week. Similar things are being done in other devolved governments. They're especially useful in detecting asymptomatic individuals. And if you have 10 or more employees, you can order tests for employees to collect from the workplace to use at home, or you can arrange for them to go to a testing centre of some kind. You've got till midnight on the 12th of April to register for this. But alternatively, as certainly for England, they announced that these were now going to be available for everyone. You may wish to take an alternative route to encourage staff to test themselves rather than through your own. Your only difficulty of that is requiring them to prove to you that they've done the test. Now then, from having seen how it works, when they've done the test, they have to show the QR code that gives the result to the app on their phone, and it tells them whether they are whether they're clear of COVID. So you can be asking people to demonstrate to you as an employer that they are doing the tests. Marketing campaign encouraging this is going to start very soon from central government. Okay. Ensure all staff know what to do if they test positive. They must self-isolate for the next 10 days along with anyone else who lives in the same household bubble. And if someone tests positive through a lateral flow test, they should go home, self-isolate, and arrange to go to a PCR testing centre. If that confirms they don't have it, they are able to come back to work. If positive, they've got to continue to self-isolate. You do not need to advise anyone now if someone has tested positive in your environment, whereas before you did. And management and early outbreak action cards have been withdrawn by the English government. Okay, next slide. Vaccines. I'm sure you've all heard the talk about vaccine passports and whether they'll be required to work, whether you'll be required to work in certain workplaces or venues. Currently, there is no requirement for leisure facilities. However, at some point in the future, some roles, such as those working closely with vulnerable people, may be required to be vaccinated. We don't know. We're like you, we're watching and waiting. When we get more information, clearly we will share that with you. But at this point in time, no one is required to do that. Evidence of a vaccine or negative COVID test may also be required for large events or entries to theatres. I'm sure you've all heard the talk going on about the test events that they're carrying out. And I'm sure that a lot of that is to do with speeding through. If everyone's got a test before going into a large event, that's going to cause crowds and build up of people. Can I just ask people to check they're on mute? We've got some background information, noise coming in. Just some old reminders. Hopefully during this lockdown, sites have been carrying out their routine checks on Legionella controls, flushing all outlets, temperature checks, etc. Sorry, can I just ask that people check that they are muted? We've got some, thank you. I think you've unmuted yourself again. Right. Okay, I think we've got them, Jill, if you want to go back to the slides. Right, okay. So hopefully you've continued to do that. If you haven't, you need to take precautionary actions before you do reopen. I know you've got very little time to do that now, but please make sure you don't pass one airborne virus on for another. So make sure your Legionella's up to date. Those with swimming pools, you can go to the next slide. Hopefully you've been carrying out tests throughout lockdown. If you haven't, you must make sure you've got a microbiological test completed and the results back before you reopen. and that you continue to follow the relevant bits of guidance from various organisations such as PewTag. Next slide. Similarly, thorough examination and testing of equipment. Make sure you're all up to date on that. If you've had any bits that have fallen out of inspection times, such as lifts, they shouldn't be used until you have had them inspected and you're up to date. So make sure you go through and check those things, that you're safe to reopen, and that where you've got sections that aren't, that isn't allowed to be used until such time as you've had it tested. Next slide, please. Okay, we've had some queries through regarding issues such as organised sport, and this has been more to do with the reopening of the outdoor sports initially, but will also apply to the indoor sports. There has been some clarification to what that term means, and it means that formally organised by a qualified instructor, club, national governing body, company or charity that follows sport-specific guidance is deemed to be an organised sport. If the sport is not organised, i.e. it's a group of mates coming down wanting to hire a five-a-side pitch, it is not deemed to be organised. So at this point in time, unless it falls strictly under NGB guidance and is controlled by one of those aforementioned groups of individuals or people, it is not deemed organised. Similarly, football clubs ignoring FA safety measures would be considered to be not organised. And I know one of my colleagues yesterday went for a walk and saw in the evening a junior football match going on with the touchline lined with spectators. Now that isn't following current safety measures. So you need to make sure where you're letting things that they are going to be compliant and that they are aware of the rules as well as you. Okay, next slide, please. We're aware that the HSE have announced that this time round they will be more enforcement orientated rather than the supportive advice. So just to make sure for your own self that if you do get a visit or there's an outbreak linked to you and you get a visit, you're more likely to be action taken to bring you back into compliance. Hopefully none of you will. I think it's important. We've clearly been through 2 lockdowns now. Some facilities haven't had staff back in between either. So many have been furloughed for a long time. Many will be anxious about returning to work either through fear of COVID or fear of getting back to work. Many will have come up with many other issues that have kept them busy and might find it difficult. I think we need to be aware of that and ensure return to work meetings are discussed, provide training as required, make sure that they're re-inducted in all the various bits of health and safety evacuation processes and COVID awareness, or which we'll touch on later. We've got a course that hopefully you can make use of to try and make sure staff are all aware of that, and make sure you continue to talk to staff. Particularly in the early days, and watch out for signs of stress and mental health issues. Staff are one of your only assets, and it's vital that they are brought back in and are confident and are able to articulate the messages confidently to customers of the precautions and controls you've got in place if we're going to get back to normality and keep open this time permanently. Okay, next slide please, Jill. There's other things to look out for. Unfortunately, we are aware that there's a range of false fake news and myths going around about COVID-19, particularly promoted by anti-vaccination media. Most of this is being spread through social media, and you just need to be prepared to counter this and make sure staff and customers are aware that there is a lot of fake news about, and ensure staff know where to obtain facts through reliable sources. We saw some Instagram information where people were saying that clubs and coaches wouldn't be insured to train people that have been vaccinated because there needed to be a long-term study of the effects of the vaccination on them before they would be allowed back in and covered. Clearly absolute fake news, and you need to be fully aware and capable of countering that if we're going to get people back confidently into exercise. which is vital. Just an update, April is Stress Awareness Month. There are tools on there you might wish to use to support staff in this return process to work. Okay. Leisure specific, you really do need to make sure, and this is for all devolved nations as well, that you keep up to date with the guidance, not only from your own devolved nation, but also from the NGBs. They are all pointing towards the NGBs as being the definitive guidance for reopening. So make sure you keep on top of it relating to the sports you're offering. More detailed guidance on sport and leisure is anticipated prior to each step. The latest updates on reopening grassroots sport still only takes us up to the 29th. They still have not issued the updated guidance, so we're going on what we believe NGBs are telling us and what we think the process will be. Hopefully that will be out soon, but a lot of this is preempting what might come out in that final guidance. Check on Sport England, Sport Scotland, Sport Ireland, etc., Sport Wales, to see whatever information they've got, and also keep an eye on UK Active Cinsfor websites too. Okay. And finally, and this will be finally from me, hopefully for a long time to come, ensure your COVID-19 risk assessments are up to date. Reinforce your existing control measures. Reinforce your existing control measures and communicate that to your staff, so they need to know what you've got in place and whether there's any changes to what you had in place for those who have been in work in between the two lockdowns. Make sure you update your pandemic management procedures. Clearly, you will, hopefully this will go away, but you need to keep on top of this in case future things occur. And communicate any new or amended measures to customers. Keep websites, social media and site information up to date. Take a walk through your facility with fresh eyes. Customers through the last lockdown will have got used to where posters were put, where sanitisation points were put. If those sanitisation points were never used, think about whether there's more appropriate places for them. Take a real good look through and make sure that you've got everything set up to be as effective as you possibly can. And review your control measures daily to ensure that they're effectively being implemented. Okay, and good luck. Let's hope that this lockdown does end up being a genuine step towards continual opening and back to normality. So I'll hand you over now to, I think it's Caroline or Jill.
It's Jill. Sorry for the slides moving about there. We had a bit of a technical issue. So thanks, Ian. There are several questions in the chat, so I'll let you read those whilst we talk about the training that we've launched. So Ian's already mentioned we've now launched a COVID-19 Back to Business 2021 training. This is to support all of your staff returning to the workplace. I was surprised when I was talking to somebody in the leisure industry a couple of weeks ago, and they've not actually worked for over 12 months. So I think it's going to be really important for you to induct your staff, and we think that this Back to Business course will tick some of those boxes for you as well. So excellent value. We've kept it really cheap for you, £2.50 per person. If you are interested, just email us at training@rightdirections.co.uk. Any questions on that, just let us know. Also, whilst we're talking training, we've launched some other online training courses during lockdown, so safeguarding awareness, Legionella awareness, asbestos, DSE, which I think will be really important, particularly with the at-home working that's going ahead at the moment, and PPE, and one which is a massive focus for everybody is the mental health awareness. Cost of these courses, we have kept them extremely cheap and affordable for you. If you're a Right Directions client, £2.50 for frontline staff, £5 for managers, and if you're not a Right Directions client, then £5 and £10. So I don't think that you will get better value for money on online training, and the courses have been written by professional leisure people who have worked in the industry. So again, if you've got any questions or queries on that training, email to training@rightdirections.co.uk. I'm going to pass you back to Caroline now, who will talk to you about Quest and moving communities.
Hi there, just a quick update on Quest Prime, because I know we've got some questions and we don't have that much long left. We'll try and keep to the hour if we can. Just to let you know that Quest Prime is now back up and running and sites are starting to be assessed again. And our next clinic, for those of you who are new to it or would like to know more, is on the 20th of May. We'd love you to join, even if it's just to have a chat and for you to know a bit more about the modules and the sort of things that are being asked for by Sport England as part of their kite mark. Also, just to let you know, for those of you who have had funding or have had funding from Sport England for the National Leisure Relief Fund, Moving Communities is now up and running. There is a website, please go and have a look. It's now all about the For Global database, Data Hub base, which is all about social return on value on social value return and data participation, Quest top level. So we probably may well invite somebody along to our next clinic to talk through all the data and how that's fed in. Our next clinic is on the 13th of May. We'd love to see you all then. Hopefully there'll be much more guidance by then. We will have a guest speaker, watch the space, maybe about moving communities and the effect on that will have on our industry. Potentially Sport England may come along on that one. Obviously, as normal, we're here to support. Please keep in touch. Come and talk to us if you've got any queries or questions, and look out for us on social media for our briefs and guidance. We're going to go over now to questions. So Jill, have we had any questions?
Yeah, I think Ian, you're going to be busy this morning, and I think you knew that.
I saw.
Yeah, you saw. I've also got some that have come in via the email as well. So the first one is we've received a Sports England grant and have invested in 6 times heat exchanger ventilation units. We have a huge building. There is still little guidance regarding airflow to achieve 100 litre per person flow. We would need a jet engine fan. Not so much a question, but a bit of a statement, really.
Yeah. I agree. It's 20 litres per person per second. So I agree. It would seem like you might need a jet engine. Certainly within your big sports halls, you've got a vast amount of space. And I think the only other control measure, if you can't prove you're doing that, is the use of appropriate CO2 monitors as per the SIPSB guidance that would help determine if there's a build-up of air, of expired CO2 within the room. So I do appreciate, I think a lot of sites would genuinely struggle to achieve those levels. And in terms of heat exchange, so long as it's not recirculating air, that it's genuinely extracting heat and putting it into the fresh air coming in, then that's going to be good. It's going to be better than probably you had before.
Thank you, Ian. One which has come in through the emails, lockers. We had lots of debates about lockers back in reopening in June last year. Question of lockers now. What's our view on facilities allowing lockers to be used?
Yeah. I think on the one-to-one activity basis that people are coming in, if they need to use a locker, so long as you are putting controls in place to support social distancing, so maybe alternate banks or alternate columns of them out of use, then there should be no genuine reason why people can't use lockers, particularly if you're providing hand sanitisation close by for after they've touched and used them.
Okay, thank you, Ian. I know we've touched on we've touched on face masks throughout the presentation, but question in here specifically around gym instructors. So is it advised that gym instructors wear a face covering if maintaining 2 metre plus?
Yeah, the rules are as people move about facilities, they do have to continue to wear face coverings. So yes, gym instructors, unless they themselves are undertaking physical activity at the time, have to wear face coverings when they're out in the public areas.
Okay, and another question has come in through the email, and again this was prevalent when we opened back in July last year. Swimming, are we still encouraging people to come beach ready?
You've got to think about your changing room areas and how speedily people will come through. I certainly think you should be encouraging people to come swim ready for the time being until we get to the next stage at least. Okay,
thank you, Ian. Moving on to a question that is on our teams, our staff. What's our advice around staff signing in daily? Do we still think we should be encouraging staff to sign in daily?
I think it's one of the essential controls that you do need to be maintaining, that staff are signing to say that they are COVID free of symptoms and that they have not been with or been contacted by test and trace, which clearly is going to become one of the more prevalent ways of controlling this moving forward as case numbers come down. I think you still really do need to keep those processes in place as much as a reminder to staff as anything else that it's still here. It's not going to go away. And the last thing we want to do is let any variants come back in and take hold that result in us being closed down. So I think there are some things that we've got long term we will have to accept and live with.
Okay, thank you, Ian. There's a question in the chat around outdoor sports, which I'll read out in a minute. However, there has been a couple of other questions that have come in via the email, so I'll sort of add them in at the same time. So the government guidance for outdoor activities has allowed people to take part in formally organised outdoor sports. And that's been the case since the 29th of March. Locally, there is a real mix of how this is interpreted regarding casual bookings. Under the current guidance, what is our stance on casual bookings, not formal, organised outdoor sport?
Given that there was clarification as to what classified as an organised sport, and I read that out during the presentation, that is what is an organised sport. So unless it's under the control of an instructor who's linked to an NGB, to a club linked to an NGB, to your company who might be organising it under COVID controls, or a charity that's organising an event under COVID controls, then it is not a organised activity. So I've seen it as well, and I think people are misinterpreting it. Given my comments about the HSE taking stricter stances and us wanting to get rid of this once and for all, I do hope people read and interpret the guidance, which to me is fairly clear.
Thank you, Ian. And just on that, so if those outdoor activities are going ahead at the moment, i.e. a football match organised, can they use the changing rooms?
The guidance again is fairly clear. They can use the toilet facilities. I think because indoor sports facilities will be open from the 12th, it is still only on a personal one-to-one basis. So a group activity should not be using indoor changing rooms. They should only be going in to use toilet facilities using social distancing. So no, I don't think they should be using changing facilities until we get to the next step.
Okay, thanks, Ian. And on the back of that, not particularly around outdoor activities, but somebody's emailed to say, where can they find the reopening guidance? They're struggling to find it.
And so are we. It's not been issued yet. You can get the stuff that takes you up to the 29th. The grassroots reopening constantly gets updated, and they haven't updated it yet with the indoor stuff. So we're like you. We're using various other bits of governing body guidance, common sense, and trying to interpret what we see. We're just hoping that when it does come out, it will be vaguely in line with what we said.
Okay, thanks, Ian. A bit of a statement for those who haven't seen the chat, not reading it, and Ian, you may want to comment on this. This is from Donna, Ice Rinks. Just a heads up, skating rinks are under the impression they can reopen for under 18s from the 12th of April and 17th of May for over 18s activities.
I think we would need to check that, and one of my colleagues has just looked up and tried to check what is out there, and it's saying it looks like only outdoor rinks can be used, indoor ones still closed till the 17th of May. So I think we need to, and maybe whoever that is with skating rinks, needs to have a very close look at the guidance before jumping to reopen.
Okay.
Ian, just so you've got a heads up, this is Donna.
Yeah.
We've had an email from the DCMS to the Ice Rink Managers Association chairman, which is Sean, who's got that in writing. So it's supervised activities for children,
Right. Okay.
and supervised activities for parent and child groups in step 2.
But
But it's not. It's obviously
hopefully it's economic for you to reopen for that limited
yeah.
group. But thank you for that.
No problem.
Thank you, Donna. A question around track and trace. We've been told by our council to refuse entry if they refuse to do the track and trace. Is this correct?
It's certainly correct that you must collect the data regarding all people using your facility. As I said, it's no longer just the lead. Whether they formally have to use the app, not everybody will have the app ability, so I don't know how we insist on that. I think it may be a point of clarity that you go back to your HSE or to your local EHOs and confirm that you'll be collecting one or t'other method of controlling people.
Thank you, Ian. Fiona has asked if we can go back on a slide around outdoor sports. I don't know if we can do that, Fiona. If we get time, we will go back for you. If not, the presentation will be up on our website on our COVID page by close of play today, so you'll be able to see all of the slides. A lot of people saying thank you for the clinic today. So another question, are we allowing one parent to attend swimming lesson clubs with child as long as they are socially distancing in viewing areas?
Ooh. Is this, because we had a conversation earlier about
outdoor sport. This is
outdoor sport.
No, this is indoor, Ian, around swimming lessons. Are we allowing one parent to attend swimming lessons / clubs with a child as long as they are social distancing in viewing areas? Do we need to get back to the...
Yeah, we need to get back on that particular point. I don't know whether Jan has got any up-to-date information on that. Again, I think a lot will come out in the final information when it's finally published. The answer is no. It's come back. Either is that no, Jan? You haven't got any information, or no, they're not allowed.
Well, just on that, whilst we're waiting for Jan to confirm on that, I know we had.
We haven't got any information on it yet. That's the answer. We haven't got information.
Okay. I mean, there is 2 other questions around sort of the swimming lessons on spectators that have come in via the email, Ian. One is around parent and babies. Swimming lessons can take place, but can parent and baby sessions take place?
We believe because they're individual activities, albeit organised, and if so long as the instructor keeps them socially distanced, we can't see why that shouldn't.
Okay, and just to clarify the conversation we had from what I saw last night when I was walking my dog around a children's football match, and probably about 60 parents spectating shoulder to shoulder on the touchline. Were they breaking COVID guidance and rules?
We think they were. Just going back, there's a question coming that I've just seen that goes back to this QR code. Clearly children under 16 aren't required to log in, but clearly if a parent is bringing them down, it would be better if they also log that they're attending the training session, so that whatever organisation is controlling it, or if it's through you as a centre, you are keeping a track of the people that are down there.
Okay. So a question around outdoor classes. So an outdoor class taken by a personal trainer is an organised sport.
Yeah, I think that's already, outdoor classes can have up to 30 people, including the trainer. They aren't allowed to use the changing rooms, as we've said, but you are allowed in a controlled manner to allow them to go in to use toilet facilities. But yeah, outdoor physical activity, exercise classes have been allowed since the 29th. It falls under a slightly different category than the organised sport category.
Thank you, Ian. A comment from an organisation who've got an indoor skate park that they can open their skate park from Monday. And then a question from a trampoline park. Can trampoline parks not reopen if a supervised children's activity like ice rinks?
I think trampoline parks have been specifically mentioned in lots of the guidance that they can't reopen until a certain date. So again, we'll have a further look at that, but I'll be very surprised.
Okay, you've answered the question around QR codes, and then we've got John Matson back on the call with us today. John, Ian, we've missed you, John, and it's nice to see you back on the call.
I think the final comment's a piss take, but still.
Yeah, Ian still got it, John, but he needs a haircut, which he's hoping to get next week. And that actually brings us to the end of the questions, unless anybody else has got any questions. I don't think we thought we'd be still sat here 11 months ago, Ian.
No. Yeah. Just one more, and then hopefully we might get back to some more ordinary health and safety based stuff to support our clients after that. But so hopefully this format won't completely disappear of doing regular updates through this, but it hopefully will have a different slant and a more relevant slant to what we all do in our everyday businesses.
Absolutely. And on that note, what I'm going to do is I'm going to pass over to Caroline, who will close the clinic. So good luck everybody for next week, and hope to see you all in May, and I'll pass you over to Caroline.
It's quite funny watching us walk away from the man with the injection on the screen. Good luck everybody. I think that's probably all from us. We look forward to seeing you at our next clinic. Take care and look after your staff and your customers, and we'll do as good a job this time as we've done all the other times on reopening, and as always our reputation I think is improving massively across the country. The DCMS obviously seem pretty happy with what we're doing, so all good news. Thank you ever so much for listening everybody, and we'll catch up with you next time. Thanks Ian and Jan as well. Thank you.